dreaming provides a form of overnight therapy. Dreaming is emotional first aid. And the quintessential disorder that we've studied that this process seems to fail in is PTSD, post-traumatic stress disorder. Because when you speak to those patients, what they will tell you is, I can't, quote unquote, get over the event. What they mean is that every time that they relive the memory, let's say it's the war veteran, they're walking through the supermarket car park, a car backfires, and instantly they have a flashback to the trauma memory of the detonation of the landmine. And what they're describing to you is they have not stripped the emotion from the memory. It's still bound to the experience. It's not coincidental that one of the diagnostic features of PTSD is repetitive nightmares. And we've put forward a theory that in PTSD, because they have too higher levels of a stress-related chemical called noradrenaline in the brain, they are not able to do the elegant trick of stripping the emotion from the memory. So what happens? The next night, the brain comes back and says, look, sleep, please. I've got this highly charged emotional trauma memory. Please do your trick of divorcing the emotion from the memory. And it fails again because of this too high levels of a stress chemical called noradrenaline. And a psychiatrist came along from Puget Sound. He worked in the VA, the Veterans Assist, and he was treating patients with PTSD. And most of them had high blood pressure. So he was treating them with a generic drug called prazosin. And the drug, it turns out, because it's the VA, it's cheap, it's generic, it crosses the blood-brain barrier. So it goes up into the brain. And he was perplexed because his patients were coming back to them and their blood pressure was a little bit better. But they started saying to him, I'm not having the nightmares anymore and my symptoms are getting better. So I had a theory that was in search of clinical data. He had clinical data that was in search of a theory. He did clinical trials. It then became the only VA-approved medication for PTSD. There have been some failed replications with that medication. I'll tell you that right now. But nevertheless, it is usually one of the first-line medication treatments now for PTSD veterans for